So this is a really interesting one because it's been reported in patients who have had bariatric surgery that take a lot of zinc supplements that there have been copper deficiencies. But like I mentioned, there was that case report in the Journal of Neurology, a patient with celiac disease who, in that case, the patient was not on a gluten-free diet. But we do see it in other folks who are and just don't have nutritious diets. So you could have anemia that's not responsive to iron. You can develop neurological defects. And the important thing is that zinc impairs copper absorption. So you just want to be careful that people aren't taking too much of one thing. Just wanted to bring a note on vitamin D and calcium because these are two very important vitamins that are often, they're being looked into more and I think diagnosed more adequately. Although, for those of up here in the Northeast, if you're in New York in the winter and you're not outside, just people without celiac disease may have vitamin D deficiencies. But it's associated with bone loss and osteoporosis. And this is a really complicated picture. This is taken from a New England Journal article, but vitamin D is something that your body makes when you're out in the sun, but you do get some from dietary sources, although not that much. So milk may be fortified with A and D. Choices like wild salmon has more vitamin D than farm salmon. And it's basically a complex process where your liver has to process it, then your kidneys. And it's thought that your goal of vitamin D really should be above 30. So that's changed where several years ago we used to think you had to be less than 10 to have a vitamin D deficiency. You really should have it higher than 30. And if you do have inadequate calcium, which again is absorbed in the proximal part of the small intestine, or a vitamin D deficiency, you can have a very elevated parathyroid hormone level. And the parathyroids sit by your thyroid and they're involved again with bone metabolism. And as far as the toxicity, just in case anyone sees this, you really don't want to go higher than 150 or 200. So we've had patients who are in that range, so you just want to be careful. So really 30 to 100 are what most experts would say would be a good level for vitamin D. Vitamin E, again, most of you know this is an antioxidant. So we do see patients that are at risk for fat malabsorption. Celiac disease is a big one, as well as Crohn's, patients with cystic fibrosis or cirrhosis. And again, it's found in a lot of nuts and oils. So the deficiencies, people can have an anemia and they can also have neuromuscular problems. So this is another last quiz. So this would be a person, this is a really bad rash. So I haven't seen any patients with celiac disease with this type of rash, but very skin lesions, poor wound healing. Patients can have poor vision at night. Any guesses? Vitamin A goes along with the vision, but for the skin lesions, especially this one like this, and poor wound healing, zinc, right? I heard someone say that. So that's a zinc deficiency. So it's 15 milligrams is the average dose. If you have someone with diarrhea, they may actually have a lot more losses of zinc. And just the other thing, just to mention, one of the things we do check are blood levels. So your body stores vitamins in different places. So sometimes you can't be 100% accurate that what you're recording by blood is your whole body store, but it's the best thing that we have. There are other urine studies, or you could do different tests. I just wanted to mention very quickly, because I feel like this comes up a lot, there are tons of probiotics out there. They're all vary by different species and what's contained in them. Some of the ones that are thought to be more helpful, the common probiotics, there are lactobacilli, bifidobacterium, E. coli, Nissl 1917, Saccharomyces, and Streptococcus. It's really difficult at this point to really recommend these to patients with celiac disease. There's too many questions out there. There are the way that they interact are basically by two different mechanisms, or the way they're hypothesized is that they're inhibiting pathogens, and the other is by modulating a person's immune system and maybe enhancing the barrier function. But there's just too many questions out there for us to really reliably advocate using these. So there are a lot of questions as far as what strains to use and what concentrations, is there contamination, and when there are so many different questions, we often don't like to complicate the situation, so just have them on a regular diet first.
Is this a regulated business?
No, and again, it's not regulated. So of the ones that are out there, some of them have been more studied. Again, all the studies are really funded by those specific companies. So a lot of it's been used primarily more in the inflammatory bowel disease population. So as far as the ones that have the most research behind them, probably VSL number 3, as well as Procter & Gamble has another product, the Align. But again, all those studies are usually funded by the drug companies as well. So as far as at the end of the day, you know, what are the best things we can advocate? Usually a multivitamin is a good thing for someone on a gluten-free diet, and just a basic multivitamin to pick up some basic deficiencies in case your diet isn't balanced enough. Assessing for deficiencies, number one, meeting with a dietitian, also doing a physical exam history and looking at the labs, and just avoiding toxicities. And again, if there's two good resources, so the USDA has a good resource looking at the content of different foods, different vitamins and minerals. You can punch a food in and it'll bring it up, and also the US FDA has a good website as well. That's it. Thanks.
Do you know if, like, claims that products like probiotics are gluten-free, how is that regulated at all?
No, so it's not regulated, but if you're interested, if some of you may have heard of this, there's a website, Consumer Lab, and basically what you do is you have to pay, it's about $30, and they do contamination testing of different vitamins and minerals. So it's basically a separate group, Consumer Lab. If you Google that, it'll come up, and you pay a fee, and you can punch in any vitamin or mineral, and it gives you a contamination. So for like fish oil, if people are concerned if there's mercury in it, it'll give you a listing.